Welcome to iCare, Infection Control, Advocate, and Resident Education. In this lesson, we will cover preventing infections in nursing home communities. We start off again on a sunny afternoon at the Springville Nursing Home. Stella Johnson, a resident at the Springville Nursing Home, is in a bit of a dilemma. With the help of her daughter Monique, she found out more information on two infections she was recently treated for. While Stella really likes the Springville Nursing Home and the people who work there, she wonders if it's safe. After all, she did get two infections while living there. Miss Johnson's son Jeffrey wants to help out this time. He is very organized and determined to find answers to some questions he has. Were his mother's infections preventable? How do germs that cause infections spread in a nursing home? What can be done in a nursing home to prevent infections? After this lesson, you will be able to answer the following questions. What is needed for germs that cause infections to spread in nursing homes? How can nursing homes prevent and control the spread of germs that cause infections? How can having communication and choice respect resident rights while preventing and controlling infections? In order for germs to spread and possibly cause infections in nursing home residents, you need three things to come together. The germ, of course. This includes bad germs, but also good germs. People, including those who are infected with the germ and those who can get infected. And lastly, the place or environment where germs and people live and come into contact. It's important to keep in mind for germs to spread, germs and people need to come together in a place where both people and germs live. So all three, the germs, people, and the place, are needed for germ spread. And of course, when germs spread, infections can happen. There are many types of germs and infections that are commonly found in nursing homes. Some germs are bad. They typically make people sick. But some germs are good and help us fight bad germs. But when good germs get in the wrong places in our bodies, they can also make us sick. Unfortunately, there is little we can do to change germs, and we can't completely eliminate them from a nursing home or any environment. But the more information we know about germs that cause infections in a nursing home, the better we can prevent germ spread. If you want to know more about germs and infections commonly found in nursing homes, please see the information sheet included in this lesson. When it comes to people, there are those people who may be infected and unknowingly pass that germ to a person who can easily get the germ, meaning that person is susceptible to getting an infection. There are a few things that can influence how easily or susceptible a person is in getting an infection. That includes their ability to think and move. A person's immune response or defenses tend to not be as strong as they age. Lastly, medical devices that are introduced into the body, like a urinary catheter or a ventilator, allow good and bad germs to get in places in the body where they're not normally found. But there are things that can make us strong against infections, and that includes vaccines, which helps our bodies build our immune defenses. Also, using antibiotics carefully and only when needed. Using antibiotics when not needed can lead to reducing the number of good bacteria and make harmful bacteria resistant to being weakened or killed by antibiotics. Now, both the germ and people can be tough to control in a nursing home. Germs will always be around since people will also always be around in a nursing home. So many times, the most effective way to stop germ spread and prevent infections in nursing homes is to target several simple possible sources of germs in the nursing home environment, such as cleaning and disinfecting surfaces and having several hand disinfectant dispensers throughout the facility. Nursing homes are required to minimize the spread of germs. They must assess the risk of infection in their facility, have an infection prevention plan in place that is based on this assessment, and then monitor how well the plan works. This infection prevention plan targets how germs get into the nursing home and also into residents. Testing residents, family, and staff for things like COVID-19 can keep germs from getting into the nursing home. Also, screening people for signs and symptoms can also keep people who may be infected and able to spread germs out of the nursing home. Lastly, to keep germs from getting into residents and infecting them, targeting cleaning, like washing your hands and cleaning surfaces that are touched often by many people, is important. Knowing when and what precautions to take before coming into contact with someone who might be infected, such as wearing a mask or using gloves, is important. When a person is infected with a germ, they may need to be isolated or separated from others to prevent germ spread. It is very important to keep in mind that federal and state laws are clear that precautions, including isolation, should be the least restrictive possible for the resident based on his or her clinical situation. In addition, a rationale for the precaution should be provided and must be removed or reduced when the resident is no longer a risk for spreading the infection to avoid unnecessary seclusion. So just to review, germs, people, and the perfect place must come together for germs to spread and infections to occur, but targeting the environment or place can prevent and control the spread of germs. But how do nursing homes target all three and keep them balanced in a way that effectively prevents infections? Well, that is why education is key. People, including residents, family members, and staff, must be educated about the prevention measures that are put in place in a nursing home. Nursing homes must then track infections and their spread in the facility. When infections and spread occur, a gap in prevention has occurred. A nursing home must find out why and fix any gaps to continue to provide a safe place for residents. So now that you know about how germs can spread in a nursing home community and how to prevent their spread, what does that have to do with resident rights and responsibilities? Well, all residents, those closest to them, including nursing community, staff, and administration, want high quality care and deserve an environment that promotes high quality care. But care cannot reach its highest level of quality if a nursing home community is not preventing and controlling infections, which we know can have a major impact on a resident's overall well-being. And as all nursing home communities experienced during the COVID-19 pandemic, infections that are not controlled in some nursing home communities can result in changes that impact a resident's rights in all communities, such as visitation and freedom to participate in activities. Residents and their families have a right to quality care. When nursing home communities work side by side with residents and those closest to them, such as family members, to prevent and control infections, this demonstrates a commitment to quality care that preserves and promotes resident rights. When infections are prevented and controlled to deliver high quality care, two major resident rights are protected: communication and choice. Residents have the right to get accurate and timely communication about infections occurring in a nursing home, and if germ spread is occurring at the facility. But nursing homes must provide only the necessary information needed to respect a resident's privacy, providing the minimum information to protect residents from germs. Residents also have the right to choose any provider they would like. Residents need to have a provider they can trust and feel comfortable with so they can openly discuss the options for treatment, care, or services, including refusal of those services. Quality care can only be achieved when nursing homes have a strong program in place to prevent and control infections. Federal and state laws require nursing homes to have an infection prevention and control program which includes a system designed to identify possible infections and disease before they spread to others, have written plans and procedures regarding when and how residents should be placed in isolation due to infection. Again, these measures should be the least restrictive as possible. And lastly, staff must also know and be able to demonstrate by observation or some other manner their knowledge and skills in infection prevention and control. So let's go back to Miss Johnson and her son Jeffrey. In this case, communication helped provide information on infections and treatments. Jeffrey helped his mother Stella find out that the Springville Nursing Home is tracking infections in the nursing home, and while Stella did get an infection, there were no additional similar infections in the nursing home reported in the past 3 months. Working with Miss Johnson, the nursing home conducts education for residents and families regarding how germs are typically spread in a nursing home. The nursing home also presents their infection risk assessment and infection prevention plan at the resident council as well as the family council meetings. This allows residents and families to know not only how germs are spread, but what the nursing home is doing to prevent their spread. One interesting item that was highlighted in the risk assessment was increased detection of antibiotic-resistant bacteria when residents do get an infection. This was the case with Miss Johnson's infections. As Miss Johnson feels she didn't get the best communication about this from her healthcare provider, she has a choice to find a new provider. With her new healthcare provider, Miss Johnson feels very comfortable. Her new provider informed her that the first round of antibiotics were not the best for her infection, so she needed antibiotics 2 different times. So there was actually one infection that was treated twice. This could have easily been prevented with the right questions and information. As Miss Johnson feels at ease with her new provider, she will feel free to ask questions regarding refusal to take any treatment until she feels she has received accurate and thorough communication to help her make the right decisions about her health. Thank you for watching this lesson. Please see the iCare website for additional lessons, information, and support.